So were you thinking of getting a knee injection put, but because someone told you something, you got really scared and decided, oh, I'm not going to go for it. Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video in which we're going to be talking about a little bit about certain myths about knee injections. First, let's understand what are knee injections. So knee injections are broadly classified into 4 categories. Number 1 is steroid injections. Number 2 is PRP, platelet-rich plasma. Number 3 is hyaluronic acid injections, and number 4 are stem cells. All right. Now, what is a steroid? A steroid is basically an anti-inflammatory. So if you have swelling in your knee associated with knee pain, steroids help a lot. Sorry to disturb you, but if you like my videos, if you have a problem in your knee and shoulder, if your family member or friend has a problem in the knee and shoulder, please call the number given in the description. My team can help you fix an appointment with me in person or online. Thank you. They are very predictable injections. They reduce swelling. What is PRP? PRP is basically platelet-rich plasma. We also have certain growth factor injections which come into the same category. They are basically a part of your blood. So you take out blood from the body, you pass it through a machine called a centrifuge, which isolates the growth factors or the platelet part of it, which is injected into the joint, and it's supposed to have anti-inflammatory properties. Third is hyaluronic acid. Hyaluronic acid is what forms the basis of the lubricant in your knee. This is a lubricant injection that's put into your knee. Fourth is stem cells. So remember, what are stem cells? So remember, cell is what is the smallest part of your body through which various parts are formed when all these cells come together. Now, how does a cell become a cartilage cell or a blood cell or whatever? So it's like you going to school in nursery. We are all cells. Then the ones who are good at a particular thing take a particular profession. Let's say I was good at biology, I became a doctor. So in school, you're schooled as to what is the best direction or path or career that you take. So cells then get differentiated into a particular specialized cell. So stem cells are like a nursery child. So when you inject a nursery child into an environment where he's surrounded by doctors, he is likely to become a doctor because he's influenced by them. So the logic in stem cells is when they're put into an environment, then they may take the path of becoming a cartilage cell. This is the logic of a stem cell in your knee. They could be human or animal derived. I prefer using human derived stem cells. So myth number 1, they say that your knee cartilage gets worse after an injection. Definitely not. So injections are largely harmless to a great extent if done in the right way. They do not damage your cartilage. None of these 4 things damage your cartilage. How much relief they will give can be a big question mark. How much? However, they're not going to worsen your condition if given properly in the right place. That's why, to improve accuracy, I use an ultrasound to give my injection. Myth number 2, once you take an injection, surgery becomes compulsory. Absolutely not. You're taking an injection to hope that you don't require surgery or to buy you time before an operation. It's not absolutely necessary that a surgery will happen because the logic of this injection is to improve your condition. It is not worsening your condition or worsening the local environment when you give it in there if given properly. Number 3, knee injections damage the knee. So knee injections, when given in the right dosage. So for steroid, not more than 2 to 3 injections in a year. Hyaluronic acid, not more than 2. PRP, not more than 2. And stem cells, not more than 1. Nothing happens to your knee if given in the right dosage. It doesn't damage your ligament, your meniscus, or the cartilage in your knee. So don't worry about it. Knee injections are very dangerous. So no, they're not dangerous. They're nascent. Luckily, they come under the category of food supplements. They may not be drugs other than steroids. Steroids are still a drug. So they are basically given this title because they cause no harm. How much benefit is questionable, but they cause no harm. The other myth is you should always exercise immediately after a knee injection. No, a knee injection is given to improve the local environment of the knee. The knee injection doesn't recreate cartilage, remember that. At least we haven't been able to completely recreate it now. Logic of stem cells is it may be able to, but evidence is not conclusive. But immediately exercising is not necessary. After a period of rest, exercise is only an auxiliary thing you do with the knee injection to improve your compensatory mechanisms for your arthritis. So who should consider injections? Number one, people with arthritis and swelling in the knee or effusion in the knee. So steroid injection is very good at reducing that. People with early moderate arthritis not prepared for a surgery. Hyaluronic acid stem cells can help you. People that have comorbidities because of which surgery is not possible. So take your chances with an injection. It may help for whatever it's worth. Number four, patients whose pain is not controlled with just medicines. Maybe your injection helps you tackle that pain, so no harm taking it. Number five, people that want to delay their operation. They're not prepared for an operation yet, so an injection can be a temporary stop shot. Who shouldn't take an injection? People with very advanced arthritis, do not take it, you're not going to get much benefit. If you have uncontrolled diabetes, etc., they can be a source of infection if not given properly. Number three, people with active joint infections. You have tuberculosis, you have some infections in your knee, avoid injections in the knee. I hope you got a lot of information about injections in the knee, some myths about them. If you like my video, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a very popular Hindi channel which has a silver play button. Please like, subscribe and follow to it. Thank you.